Today I'll be presenting my storyboard and prototype for a 15 to 20 minute LMS-based microlearning activity. I structured this presentation into 4 parts. First, I will briefly introduce the learning context and outcomes. Second, I will explain about the instructional design principles by walking through the storyboard. And third, I will demonstrate the prototype. Finally, I will conclude with a summary of the presentation. I hope you will enjoy it. The target learners are Year 5 dental students who already possess foundational orthodontic knowledge. This activity is designed as a short LMS-based microlearning because learners today often prefer concise, focused, and interactive learning experiences. And the topic selected is underbite or Class 3 malocclusion. The two learning outcomes are: first, students should be able to describe the principles of interceptive treatment, including timely interception. Second, students should be able to demonstrate orthodontic assessment and treatment planning for Class 3 malocclusion. To organize the learning content, I divided the microlearning activity into several key sections. First would be history taking. Then it would be extraoral examination, followed by intraoral examination, investigations, diagnosis and etiology, and finally, management. Cognitive load theory explains why students may disengage during lessons due to the additive nature of cognitive load. Poorly designed instructional materials may overwhelm students' working memory capacity and create additional extraneous load. Therefore, effective instructional strategies are important to reduce extraneous load and optimize domain processing. Hence, I will outline two important principles used to create an engaging microlearning activity. The first is Mayer's multimedia principles, which comprises of 12 components. I will demonstrate the application of these principles using the flower symbol throughout the storyboard. Meanwhile, my favorite principle for lesson organization is the Gagne's 9 events for instruction, which I will highlight using a star throughout the storyboard. The learning experience begins with a clinical case scenario involving a 7-year, 9-month-old girl named Stella who presents with concern about her smile and underbite. I intentionally use storytelling at the beginning to gain learners' attention and increase emotional engagement. The child shares that her friends laugh at her and call her grandma, which helps learners appreciate the psychosocial impact of malocclusion rather than viewing it merely as a dental problem. The learners are also informed of the learning objectives following Gagne's 9 events of instruction second principle. As for Mayer's multimedia principles, a real human voice is preferred over a machine-generated voice to create a more personal learning experience. In addition, the narrator's talking head is not included, as it does not improve learning outcomes. Therefore, following my presentation after this, I will not have the talking head. The opening slide also includes a clickable start button to encourage learners' control and interaction. This aligns with learner-centered online education principles. The next component is an interactive question, asking students what important questions they would ask during history taking. I incorporated this activity to stimulate recall of prior learning, which corresponds to Gagne's third event of instruction. It also encourages active participation rather than passive content consumption. Also, this activity is likened to Mayer's third principle, which is pre-training, whereby students learn key concepts before applying them. Students are then presented with the content of orthodontic assessment, beginning with the history taking process. The storyboard demonstrates conversations between the dentist, Stella, and her father. The dialogue-based format was intentionally chosen because it creates authenticity and personalization and simulates real clinical communication, highlighting another of Mayer's principles. The next section focuses on family history. Stella's father explains that the mother previously underwent orthodontic surgery for a similar condition. This helps students recognize the hereditary component of class 3 malocclusion and encourages clinical reasoning regarding the etiology. Learners can then navigate through the microlearning activity using the back and next buttons, allowing the content to be presented in a smaller segments rather than a single continuous presentation. This demonstrates another important principle of Mayer's multimedia principles, which is the segmenting principle. After that, learners explore the medical, dental, and social history using clickable pop-up sections. This design supports self-paced learning and reduces cognitive overload because students can process one category of information at a time rather than reading excessive information simultaneously. This also highlights the coherence principle in Mayer's multimedia principles, which emphasizes the removal of unnecessary material that is not relevant to the task at hand. The microlearning activity then transitions into the actual oral examination. Students assess the patient's facial profile, vertical proportions, smile characteristics, and facial symmetry. Interactive markers are added to the photographs so learners can click and identify important findings themselves. This promotes observational learning and active discovery. In terms of Gagne's 9 events of instruction, this section provides learning guidance by demonstrating what important extraoral findings look like clinically. The pop-up labeled Key Learning also applies a signaling principle from Mayer's multimedia principles, where cues are used to direct learners' attention to important material. Similarly, the intraoral examination section uses intraoral photographs with clickable markers to highlight features such as anterior crossbite and occlusal relationships. This allows learners to visually connect theoretical orthodontic concepts with actual clinical findings and highlights the multimedia principle, which states that learners understand better from words and images together than from words alone. The next section introduces an important interactive decision-making question regarding whether the anterior crossbite is functional or skeletal in nature. If learners answer yes, they're directed to an instructional YouTube video demonstrating centric relation recording. This provides immediate learning support and scaffolding. The photograph of the female doctor with a thinking expression demonstrates the spatial and temporal principles whereby corresponding words and images should be placed close to each other and presented simultaneously to engage the learner. Investigations are then presented using a lateral cephalogram. The narration guides students to interpret the skeletal relationship and identify that the patient has a mild skeletal class 3 pattern due to a retrognathic maxilla. This highlights the final two principles of Mayer's multimedia principles, redundancy and modality, where images with narration are more effective than combining images, narration, and on-screen text. Following this, learners arrive at the diagnosis and etiology section where the clinical findings are synthesized into a diagnosis. At this stage, students are encouraged to integrate information from history, examination, and investigations to arrive at clinical conclusions. The management section uses another interactive question that asks learners to select the most appropriate treatment option, aligning with Gagne's 6th event, which is eliciting performance. Learners are encouraged to apply what they have learned through interactive questions. Correct answers are reinforced with positive feedback, while incorrect answers prompt re-attempts. This immediate feedback mechanism is important in online learning because it helps learners correct misconceptions early and reflects Gagne's events of instruction. Microlearning activity concludes with a positive treatment outcome where Stella and her father are happy with the improvement after growth modification therapy, ending with a successful outcome reinforces the value of early interceptive orthodontic treatment, and provides emotional closure to the story. In addition to the main learning sequence, I also incorporated self-check questions to assess performance to evaluate if learning objectives were met. Learners can test themselves independently and receive immediate corrective feedback, which supports assessment. Finally, further follow-up scenarios and questions are included to enhance retention and transfer, which is the final event in Gagne's 9 events of instruction. I would now demonstrate the prototype briefly to show how learners navigate and interact
On
with the
examination,
activities.
Stella has a straight profile.
In conclusion, this storyboard was designed to create a concise, engaging, and clinically relevant online learning experience for Year 5 dental students. The first framework used is Cognitive Load Theory by Van Merenboer and Sweller. Orthodontic diagnosis can be cognitively demanding because learners need to integrate multiple clinical findings simultaneously. Therefore, I reduce extraneous cognitive load by segmenting the content into smaller sections and using clear navigation buttons. The second framework applied is Mayer's multimedia principles. For example, the personalization principle was incorporated through conversational dialogue. I also applied Gagne's 9 events of instruction. The case scenario gains attention, learning outcomes inform learners of objectives, interactive questions stimulate recall, the storyboard presents content progressively, guidance is provided through narration and pop-ups, performance is elicited through quizzes, feedback is immediately provided, self-check activities assess performance, and finally, retention and transfer are enhanced through clinical application. By integrating cognitive load theory, Mayer's multimedia principles, and Gagne's 9 events of instruction, this microlearning aims to enhance learners' engagement, reduce unnecessary cognitive burden, and promote meaningful clinical reasoning. Thank you very much for your attention.